During surgery, a cardiologist once described holding a 68-year-old patient's artery in his hands. He said it felt like concrete, not flexible, not elastic, not alive, concrete. And here's what shocked him most. This patient's blood pressure had been controlled for years. On medication. Numbers looked fine on paper. But the artery told a different story. And in 2023, a major publication in the Journal of the American College of Cardiology revealed something disturbing. Even patients whose blood pressure was controlled on 3 or more medications had nearly the same risk of heart attack and stroke as those whose blood pressure remained uncontrolled. So, what are we missing? Today, I'm going to show you the one thing that keeps blood pressure elevated, even when you're doing everything right, and nearly 99% of people never think to turn it off. It's not just salt, it's not just weight, it's not just genetics, it's your sympathetic nervous system. That's your built-in fight or flight switch. It was designed to protect you from danger, but after 60, for many people, it never turns off. When this system stays activated, blood vessels tighten, heart rate increases, stress hormones flood the bloodstream, arteries stiffen, sleep becomes lighter, blood pressure rises, sometimes all night long. And here's the part most doctors don't emphasize. You can't out-medicate a nervous system that's stuck in overdrive. If the stress switch stays on, your blood vessels stay tense. William was 72. His blood pressure was 178 over 104. He was on 4 medications. 4. He felt exhausted. His mind raced at night. He startled easily. He couldn't relax, even sitting in his chair. His cardiologist added another prescription. Still high. What finally changed things wasn't a new pill. It was learning how to turn off his stress response on command. Within weeks, his numbers dropped. His sleep deepened. His doctor reduced 1 medication. What he learned is what I'm about to show you. These are not replacements for medication, but they are powerful nervous system resets. Now for 7, the diving reflex reset. Now this one may sound unusual at first, but it's incredibly powerful, and it's built into your body. It's called the diving reflex, and you've had it since birth. In fact, it's the same reflex that allows marine mammals to slow their heart rate instantly when they dive underwater. Here's how you activate it. Fill a bowl with cold water, not ice cold to the point of pain, but clearly cold. Take a normal breath in, hold it gently, then splash your face generously with the cold water, or carefully submerge your face for 10 to 20 seconds. That's it. Within seconds, something remarkable happens inside your body. Your heart rate slows, your blood vessels shift, your nervous system changes gears, and blood pressure begins to drop. Why does this work? Because when cold water touches specific areas of your face, especially around the eyes and nose, it stimulates branches of the trigeminal nerve. That nerve sends an urgent signal to your brainstem, and your brainstem responds by activating the vagus nerve. The vagus nerve is your body's built-in brake pedal. When it turns on, heart rate decreases, stress hormones reduce, blood vessel tension eases. The fight or flight response quiets. In some controlled settings, people have experienced drops of 20 points or more in systolic pressure within 30 to 60 seconds. Now, let's be responsible here. This is not a replacement for medical treatment. It's not a cure, but it is a rapid nervous system reset, and it's especially helpful during sudden stress, anxiety spikes, emotional upset, a racing heart feeling. Many seniors experience blood pressure spikes triggered by stress, not physical exertion. This gives you a tool, something immediate, something biological, something you can control. And here's something important. As we age, the sympathetic nervous system, the gas pedal, tends to become more dominant, but the vagus nerve, the brake, can become less responsive unless we stimulate it intentionally. Cold water is one of the fastest ways to do that. Now, a few safety notes. If you have severe heart rhythm disorders, consult your doctor before trying. Do not use extremely icy water. If you feel dizzy, stop immediately. Most people tolerate it very well, and many report feeling calmer almost instantly. You may even notice your breathing slow naturally afterward. This isn't a trend, it's not a supplement, it's not a gadget, it's hardwired human physiology. And sometimes the most powerful resets are the ones your body already knows how to do. Number 6, the Valsalva maneuver. This next technique has actually been used in hospitals for decades. It's simple, it's free, and when done correctly, it can influence your heart rhythm and blood pressure within minutes. It's called the Valsalva maneuver. Here's how to do it. Sit down comfortably, take a normal breath in, close your mouth, pinch your nose shut. Now gently bear down, as if you're trying to exhale forcefully, but not letting any air escape. Almost like you're trying to blow up a balloon without opening your lips. Hold that pressure for about 10 to 15 seconds, then slowly release and breathe normally. Now here's what's happening inside your body. When you bear down, pressure builds inside your chest cavity. That pressure briefly changes the amount of blood returning to your heart. Your body detects this change instantly. Special pressure sensors called baroreceptors are located in your chest and neck. Notice the shift, and they send a message to your brain. Pressure is rising. In response, your nervous system activates the calming side, the parasympathetic system. Heart rate slows, vessel tension decreases, and in many cases, blood pressure temporarily drops within 60 to 90 seconds. In fact, emergency rooms sometimes use a modified version of this technique to help reset certain rapid heart rhythms. That's how powerful it can be. But let's be clear, this is not about straining aggressively. This is controlled, gentle pressure. You should not feel pain. You should not feel like you're about to faint. And you should always be seated when doing it. Now, an important safety note: if you have known heart rhythm disorders, a history of stroke, advanced heart disease, or recent surgery, you should speak with your healthcare provider before trying this. For most people, done gently and occasionally, it's safe, but we always prioritize caution. Now here's when this can be helpful. During a sudden stress spike, if you feel your heart racing, if your blood pressure reading is higher than usual due to anxiety, it gives you a way to engage your body's natural pressure regulation system, not by force, but by physiology. And something powerful happens when you realize you have tools. You're not just waiting for a pill to work. You can influence your nervous system. And when you calm the nervous system, blood pressure often follows. Chakra 5, the 4-7-8 breathing method. Now this next one may look simple on paper, but don't underestimate it, because your breath is directly wired into your nervous system. You can't consciously control your blood pressure in the moment, but you can control your breathing. And when you control your breathing, you influence everything downstream. Here's how the 4-7-8 method works. Inhale gently through your nose for 4 seconds. Hold that breath for 7 seconds. Then exhale slowly through your mouth for 8 seconds. That long, slow exhale is the key. Repeat this cycle 4 times. Now let's talk about why this works. When you breathe slowly and extend your exhale, you activate the vagus nerve, your body's calming pathway. The sympathetic nervous system, the fight or flight side, quiets down. Heart rate slows, blood vessels begin to relax, stress hormones decrease. In some studies, slow breathing practices have reduced sympathetic nervous system activity by up to 40% in under 2 minutes. That's significant, especially during moments of anxiety, frustration, or sudden blood pressure spikes. And here's something important for seniors. As we age, breathing patterns tend to become shallower. We take quicker, shorter breaths, often without realizing it. Shallow breathing signals subtle stress to the brain. It keeps the body in a low-grade alert state. Over time, that can contribute to higher baseline blood pressure. The 4-7-8 technique reverses that pattern. The longer exhale tells your brain, you are safe, and safety signals allow your blood vessels to soften. Now here's how to use it strategically. If you check your blood pressure and it's elevated, don't panic, sit down. Place both feet flat on the floor, relax your shoulders. Do the 4-7-8 cycle 4 times. Wait 1 minute, check again. Many people see a noticeable difference simply because they stopped feeding the stress response. You can also do this before bed, before a doctor's appointment, before checking your numbers, before a difficult conversation, and if you're in the middle of a spike, run the cycle 3 times in a row. Breathing is one of the few levers you can pull instantly. No equipment, no cost, no side effects, just physiology. And sometimes the fastest way to lower pressure is to slow everything down. Now let's talk about the real shift. Emergency techniques are helpful, but the goal isn't to fight spikes. It's to lower your baseline, to turn off the overdrive permanently. Here are 4 daily techniques that reprogram your nervous system over time. Number 4, heart rate variability. Coherence breathing. Breathe in for 5 seconds, out for 5 seconds, for 5 minutes. That rhythm increases heart rate variability, a marker of nervous system flexibility. Studies show average reductions around 10 mmHg systolic over time, 5 minutes in the morning, 5 minutes before bed. Consistency matters more than intensity. Number 3, progressive muscle. Relaxation. Inhale and tense your calf muscles for 5 seconds. Exhale and release for 10 seconds. Move upward through the body, feet, legs, hands, arms, shoulders. This teaches your brain the difference between tension and relaxation. Many seniors live in low-grade muscle contraction without realizing it. Relax the body. Vessels relax too. Number 2, vagal tone breath holds. Exhale completely. Hold your breath gently for 5-10 seconds. Resume slow breathing. Repeat 5 times daily. This strengthens your vagus nerve, your natural blood pressure stabilizer. Over time, your system becomes less reactive. Number 1, the most important, circadian realignment. This is the one thing most people never turn off. Late night stimulation, screens, bright light, news, phone scrolling. Light after sunset tells your brain, stay alert. Morning light tells your brain, reset blood pressure rhythm. Get 10 minutes of morning sunlight within an hour of waking. And stop bright light exposure 1-2 hours before bed. This single habit improves sleep, lowers nighttime stress hormones, and reduces morning blood pressure surges. Seniors are more sensitive to circadian disruption than younger adults, and this might be the biggest hidden trigger of all. Turn off late stimulation, turn on morning light, that's the switch. William reduced from 4 medications to 1. Susan's systolic dropped 18 points in 2 months. Thomas finally slept through the night, and his morning numbers normalized, not by adding more drugs, by turning off the stress switch. Don't try everything. This week, pick 1 emergency technique and 1 daily reset habit. Do them consistently. Your nervous system learns through repetition. You are not broken, you are not weak, and you are not powerless. Your blood pressure is not just a number, it is a signal. And sometimes the most powerful change isn't adding something, it's turning something off. If this helped you, comment calm below. Next week, I'm sharing the 1 blood pressure medication that may actually help arteries heal, not just lower numbers. Subscribe so you don't miss it. This is Senior Health Tips. And after 60, strategy matters more than ever. I'll see you in the next video.